Hi there, Dr. Sandhu here with my wonderful patients, Michael and Jack, who both are going to learn something today, and they very kindly volunteered to just help for me to teach them and to teach you two really important exercises. One is basically to strengthen your core muscles, which if you think of an example that I saw on YouTube was where this gentleman described it as an anchor. So it's a solid anchor here in your base, which is your core. And that is what gives you that stability when you make any kind of sudden movements or any kind of movement that puts you off balance. And of course, if you're lifting anything as well or raising your arms above your head, you're going to be using your core. In fact, you're using it all the time. The other most important muscle that we're going to work on is, Mike, would you mind just turning your back to the camera? That's it. These muscles in here. Right, now these muscles in here they're called sort of quadratus lumborum, but there's actually sort of 4 layers of what are called the erector spinae muscles. And they consist of sort of muscles that actually go from the pelvic here right up and join up into the ribs and actually go up into the thoracics, about T8, T7. And they run on the side here. And what they do is they give the lumbar spine that lateral support. And then, of course, you've got the transverse abdominis. But the muscle that we're going to be focusing on today is what's known as the quadratus lumborum, which is that bundle of muscles on either side of the lumbar spine here in your lower back. So the first exercise is really simple. What we're going to do is we're going to sort of use something like a radiator or something heavy, something strong to put a band against. So Jack is going to be that stabilizing point for us. And then what we're going to do is we're going to take the band and we're going to find a point where there's a little bit of tension in it and it comes to our center. It comes to our center. We're then going to take it with both hands. So now this band wants to pull me in that direction. Okay, but what I'm doing is I'm going to resist that tension that way, and I'm going to take it here. I'm going to keep my knees nice and soft, so I'm not extending my knees, and I'm going to take, in fact, I'm going to go a little bit further, so I've got a bit more stress now, pulling me towards Jack. And then what I'm going to do is I'm just going to take my hands and I'm going to take them forward. Now what's happening here, and Jack can feel it, is he's trying to pull me, or the band is trying to pull me towards him. But I am keeping straight and I'm pushing my arms forward. And as I'm doing that, what I'm feeling is I'm feeling all these muscles here work like crazy, especially on this side, because this is a side that's taking the most amount of stress. Mike, come and try this.
Yeah.
Okay, so you're going to take both hands, so that's it, clasp them, and just take it so that you can feel that bit of tension.
Okay.
Okay, you got it?
Yeah.
Fantastic. Chin up, soft knees. That's great. And all you're going to do is you're just going to straighten your arms and you're going to push forward. Can you feel that?
I can, yeah.
Yeah, it's good, isn't it?
Yeah.
What do you feel? Just describe.
I feel that tight in that side, all the way down.
All the way down
right
here.
up to my shoulder.
Absolutely.
Yeah, but I actually feel that in the QL on that side.
You will, because remember that QL is a bit tight on you. So this exercise, for you, right, you would only do maybe 2 or 3 at the most at the moment.
Okay.
Okay?
Yeah.
Because that QL is a little bit tight on you. And obviously that's one of the muscle group that you're working, because you're working this core here.
Yeah.
Okay?
Okay.
So what would you normally do? Well, if it is not uncomfortable, you would do anything from 5 to 10. Nice and slow, nice and controlled, and you do between 5 and 10 of those. Have a little rest for 10 seconds. Breathe. Always try to breathe through your nose, because that's where you're producing nitric oxide, because we're meant to breathe through our nose, not our mouth. So that you're warming the air up, you're passing it through the sinuses, but most importantly, you're producing something called nitric oxide, which is one of the most powerful antioxidants next to glutathione that our body produces, and superoxidase dismutase. So really try to breathe through your nose when you're exercising as much as you can and during the day. So you do 10 of those, take a breathe for 10 seconds, and try and do 3 reps. 3 reps. Okay, all good?
All good.
Good? Excellent. Would you like to have a go?
Yeah.
Yep, fantastic. So I'll support. Mike, you teach.
Okay.
Okay, how to do
You
this.
come out as far as you can, so you've got some resistance to the band this way. So you've got some kind of tension on that shoulder. Keep your elbows tucked in. Bring your elbows nice and tucked in. Now slowly sit yourself down. Sit your feet into the floor so you're stable. Now push your arms slowly forward, feeling the resistance.
Chin up. Can you feel that?
Really in the core.
Yeah, it's amazing, isn't it? It's an amazing little exercise.
Bring it back when you're slowly ready.
That's good. And what you can do is you can work your breathing with it. So breathe in, and then as you push out, breathe out through your nose. That's it. And breathe in, bring it back, hold it for a second, and then go forward again. Beautiful. Thank you. Well done. And you can feel it.
That's really good, yeah.
Yeah, it is. Okay, so, well, as you demonstrate that beautifully, you can demonstrate the next one. The next one's very similar, so let's do that again. Okay, but this time what we're going to do, this is for the QLs. So that was for the core muscles, the transverse abdominis and the deep core muscles. This one is going to be for the QL. So what we're going to do is we're going to do the same thing again, but this time we're going to bring it to here. Instead of taking it forward, we're going to raise our arms above our head. Above our head, okay?
Yep.
Keeping that tension again. So, that's it. Beautiful. Not too much. Just start a little bit easier first. Once you get used to it, then you can add more tension on. And all you want to do is keep the body close, keep the arms close to you, and raise the arms above your head. Keep going, keep going, keep going, keep going. As high as you can. That's it. And back down. Breathe out. Perfect. Breathe in. That's it. And breathe out as you go. All the way up. Up, 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 up. Yeah, it's good, isn't it? I mean, it's such a simple movement, but you can really feel it. Yeah. Have a go.
Go on, I'll have a go. I don't want to feel left out, do I?
Right. Okay, so would you like to teach this time?
So bring it a bit closer.
Yeah.
That's it. Just bend your knees a little bit.
Nice and soft. That's it. Plant into the ground.
Perfect. And then just lift it up, close and breathe out.
Because what most people do is when they have a QL pain, the pain on the side, they tend to stretch it.
Right.
Stretching is okay, but it actually needs strengthening.
Yeah.
And this is a strengthening exercise, a strengthening movement.
Perfect.
Very good. Good form there. Good form, Michael. Well done. But being a dancer, hey. Fantastic.
Thank you,
guys,
guys.
thank you so much. Okay, if you look over there for me. Wonderful. So, Bedford Chiropractic Clinic, 2 great exercises. Do please watch the video again as many times as you want to, and make sure that you get that form. And both illustrated the form beautifully. All right, so you know what to do. QL and your core muscles, so important in our daily activities, daily life, and such a simple, effective exercise to do. Bedford Chiropractic Clinic, we're here to help, and follow us on social media, follow us on YouTube. There's lots of other education videos for you to watch. Guys, you were amazing. Thank you so much. Thank you.